Most ankle fractures involve a dislocation of the joint or is inside the joint. And that's something that, if it's not fixed properly, will cause a degeneration of the joint. There's 3 distinct signs that patients need to be aware of. Number 1 is it's just bruising. You injured something if you bruised it. Number 2 is swelling. Okay, if you tear tissue, if you tear a ligament, or if you break the bone, you're gonna get swelling and bruising. So you did some kind of damage that needs to be checked out. The third thing in a unique symptom is patients often say they hear a pop. It needs to be checked out, and if they hear that pop, they tore their ligament to their ankle or they broke the bone.
I was on a canoe trip and I went off a rope swing and landed on a submerged rock. Broke my fibia and broke my ankle. Didn't know it until 2 days later when I came in here on Monday.
He just thought he sprained his ankle. Comes in and the bone is broken. It's inside the joint and the bone is starting to push out, so the joint is now widening, so the joint is not lined up at all. That type of fracture, if not fixed correctly, it will destroy the joint. Post-traumatic arthritis will sit in, it will not heal right. And you want to fix it soon. If you wait 6 weeks down the line, you can't get a good enough reduction. You can't get that joint 100%. You get those early and surgically repair them. You can line up that joint 100%, let it heal, and he will heal 100% from that.
It's a little sore, but it's gonna be. He told me that, you know, he goes, you'll get a little sore here and there, which is fine. So, but I mean, that's to be expected with recovery time and the process. You know, I'm not back running yet, but he gave me permission to go snowboarding, so. Yeah, recovery time was good. I'm back up doing what I want.
Great patient, healthy, young, just had to put his ankle back together surgically, and he's gonna have some joint stiffness and some mild achiness that'll wear out over time, but after a year, after these, he's do whatever he wants and fully heal.
Dr. Amelung is a great guy. Really takes care of his patients. I mean, doesn't sugarcoat it, you know, as far as like, you know, he's like, yeah, you broke it. No more playing around, but yeah, he's a great guy, great doctor.